go ahead and get started. There will be an opportunity for standing up and sitting down in a few minutes, so if you're feeling a little sleepy after lunch, and then later we're gonna get everybody up and moving around, so we won't just like make you sit here for an hour and a half and feel sleepy. So I'm Laura Brunson with Water for People, really excited to see a lot of folks in this room talking about really important subjects. And I should just caveat this, I'm representing my colleague Ruby, who did the bulk of the work with friends and colleagues here to help plan the session, and I am just filling in because I'm at the conference, but super excited to have learned a little more and met some fantastic people. So we are talking about menstrual health and hygiene and periods today, and I was reflecting last night. I remember, I don't even know, maybe 15 years ago as a graduate student, I read The Last Taboo, which is a book many of you have probably read about toilets and how sanitation for a long time has been considered this taboo subject. People are awkward talking about it. It's much easier to talk about water wells and drinking water access than it is to talk about open defecation and the state of toilets. Although I make my friends talk about toilets a lot these days. But I was reflecting that actually I think menstrual health and hygiene is much more of a difficult and taboo subject than talking about toilets. And so I love it that at this conference here there are several really excellent sessions. We are all talking about it a lot more. When I go to like universities to talk to students or talking in events like this, there's so much more conversation about it than there ever used to be. And recently I was at a university talking to a couple of classes, and I just was throwing out terms and talking about menstrual health and hygiene and the importance of facilities in schools. And the students didn't look concerned about that at all. And so I was kind of hopeful that the next generation is really much more open about some of these things. So speaking of education, that is what we're here to talk about today, because I think we all know how incredibly important it is to support menstrual health and hygiene education and awareness. And it is not just important for girls as they're growing up and starting their menstrual cycles, it's also really important for parents, for families, for teachers, and for boys to really understand and be advocates and supporters for persons who menstruate. And that education can really help women be able to manage menstrual hygiene with dignity and to be empowered. So that's what we get to talk about today. And I have Emily Cruz from Splash, Rose Rigwa from Water for People Tanzania, and Lena Frank from Wash United with us today. And what we're gonna do is take you on a little, and Robert is going to join us by video. So he works closely with Rose and the Tanzania team. And so what we're gonna do today is go on a little bit of a journey. First, we will talk about global solutions to period education, and Lena has some really interesting things that Wash United does to help support anyone in the sector to facilitate education in some really helpful ways. And then I get to come back up here and talk a little bit about a specific example of how Water for People has been using those materials. And I can give a couple examples of what that looks like and why it's working well in the nonprofit sector. And then Rose and colleague Robert will take us on a journey through Tanzania's MHH transition and growth. And I think that's really interesting because they talk about the importance of the evidence in informing then what Tanzania has done along this path. And then we get to hear from all of you and your experiences and do a little brainstorming as people who really care about MHH. So that's our plan for today. We will have a little bit of an occasion to do a little Q&A as we go. So ladies, anything I've missed?
No.
All right, I think over to you, Lena.
Cool. Hello together. I don't know where to stand. I'm really small, so let's see if that works. All right, so to start with, I would like us, I think we're enough people for that, to play a little game. Well, first of all, I'm Lauren already introduced me. I'm Lena Frank from Wash United. You may know Wash United because we're the initiators of MH Day. But I hope from today on you will also know us because we have specialized in developing MHM education materials. You can find them here, together, of course, with our partners across the world. And yeah, so I hope from today on you will also know us because of that. All right, so to start with, I would like to, as I said, play a little game with you. I will ask you a couple of questions, and if the answer to the question is yes, I would like you to stand up. So, are you ready?
Yeah.
Question number 1. Please stand up if you received good and empowering peer education at school. Independent of your gender, so if you menstruate, please stand up if you receive period education that made you fully understand what is happening and trust that periods are not going to hold you back. If you don't menstruate, please stand up if you receive period education that helped you understand the topic and be a better ally. If you agree that you received empowering education, stand up.
Before we had our
Yeah.
periods?
Before you had your period.
I don't remember.
It's okay. It's okay. It's okay. I'm trying to make a point. So thank you.
Very empowering.
Question number 2. To the people who menstruate in the room, please stand up if you never, ever felt any shame around your period. Okay. Question number 3. Please stand up if you believe that better period education is essential to changing this. So ending stigma, to empowering girls, and to building a more supportive environment. Yay! So thank you very much. You can sit again. I just love letting the room speak. And I think that's a solid starting point for this session. I tend to make things a little bit too interactive, so we're going to continue playing a little game. There will be, I want to dive into the topic, obviously, so there will be numbers popping up now, and I would like you to shout out if you know what this number stands for. 28. Yeah. I mean, we're here in the period room, right? That's an easy one, right? 28 is the average length of the cycle. Yeah, okay, that's all talking to. And so here, a lot of you are wearing the bracelet. This is also why MH Day is on May 28th, because these numbers are included into that day. And also the bracelet that is the symbol of Menstrual Hygiene Day and the awareness is made up of 28 beads with 5 of them being red. So just in case you didn't know that, that's the thought behind it. All right, so there's 3 more numbers coming up. 3,500, now it's becoming a little bit more complicated. What could that relate to, that number?
Number of days you have a period in your life.
Wonderful. Number of days a person who's is menstruating across her reproductive lifetime. Yeah, quite some days I find that we're dealing with this. All right, next one. 2.1 million.
People menstruating globally.
Yes, that's the number menstruating worldwide. Actually, from the new report, we just updated that number. Thank you for the new JMP report. And the next number, that's from the National Library of Medicine. Anyone knows what that number refers to? That's the number of women, person menstruating right now, at this moment. So, these are quite some numbers. So I guess we have a global situation here. We're talking about global solutions today. Let us quickly summarize basically the global baseline we can all agree on. I think we can all agree on that menstruation is natural and actually a good sign of health, a sign of good health. Period education, we have just talked about it, contributes to girls feeling empowered and less ashamed about their periods. However, period education is still not inherently included in school curricula across the world. So whether it is Germany or the US or Tanzania, it's there are exceptions, but pretty much nowhere it is unfortunately included in the curricula. And I think we can also all agree that girls need educational support when it comes to their periods. All right, but the good news is there are loads, it's very sensitive here. The good news is there are loads and loads of organizations, be it governmental bodies, be it NGOs, be it community organizations, interested in implementing MHM education, seeing the need to address the topic. And as WASH United, it is our goal to make it as easy as possible for them to get the ball rolling without having to spend time and money for product development. So that's why we, together with partners across the world, have developed these period education guides for world regions currently, with many versions within these world regions. Obviously, there is no one-size-fits-all approach. And these period education guides are free for any organization across the world to address the topic and they can just download them for free and use them for their own programs. So this is what we call an indirect implementation model that we have started since we stopped implementing on our own. We did that in the past as well, but now really have focused on providing organizations with the material so they can start working on the topic. So where are we with this model right now? As you can see, we have so far more than 30 versions of the guide that you can download from our website. We have more than 700 organizations currently using the guide. So that's a wild mix of different organizations that can be governmental bodies. We're, for instance, working with the government of Burundi, government of Congo, in the framework of the GAMA project, the Ghana Ministry of Water and Sanitation and Water Resources is using Rosie's word. It's called Ama's World there because Ama means born on a Saturday. Then there's health organizations like what's it called again? Social Entrepreneurs Uganda using the guide. Also individual schools and of course Water for People. So and they together have reached, since 2018, more than 2.7 million girls. So the investment that WASH United does into the product development is leveraged by hundreds of organizations, reaching more girls and maximizing this collective impact here. Now, why does the guide work? This always sounds like a big ad. Why does it? But just from our partners and from continuously improving the guide, I want to point out why it works for such a big range of organizations. And what we hear mainly is because of its group-based approach and because it's story-driven. So it's really fun for the girls, and it's really easy for the teachers to conduct the training because they don't have to be period experts. They read out the story, the girls can really connect to the character, and it's just fun. It is also a lot of fun activities included. So it's for the girls. There's it's an easy to how to say absorb, very easy to absorb, and by doing so, it goes beyond knowledge. So it really empowers the girls, and it fosters this mutual support that we wish for the girls to establish if they don't have it yet. Then it's very flexible when it comes to implementation. So it's being used in a peer-to-peer approach. It's used in humanitarian aid settings. It's largely used in school settings. So yeah, there it's really flexible, and it's also quite scalable because it's not a take at home material, but the printing is just for the teachers, so they just need one copy of the guide, and that makes it very low cost. And yeah, apart from that, it's adjustable to the local needs. As you already saw, we have a number of off-the-shelf versions, but if the need is, especially if there's like big rollouts planned, of course, people can come up to us. We're always happy to come up with new versions and make sure that you know, for bigger rollouts, the organizations really have a very good local fit. Yeah. So these are just some of them, because right now we have too many versions to display all of them. But on the left-hand side, you can see the Sub-Saharan versions of the guide. In the middle, there's the Asian versions of the guide. Then we have Middle East and North Africa, as well as Latin America and the Caribbean. And you can see there's like a little bit of a different style to every world region. Yeah. And as I said, every version is developed with local partners in terms of, you know, context changes, of course, languages, obviously, but also design. Yeah, and when you download the guide, you also get a support set to come with it. Oh, pad making, I was going to throw that in yesterday, that we also have a pad making booklet for, you know, schools or also community organizations who want to get into that. And then, of course, the resource book is for the teachers. So, you know, there's like typical questions and answers that the girls ask, so that they have something to refer to, as well as a TOT in case an organization or many organizations actually do that, you know, to kick up the program to do a training of trainers with the teachers or trainers. And then, very important, a monitoring and evaluation toolkit, because of course we are interested in finding out, you know, not only how many kids the girls reach, but also, you know, whether the program was impactful or not. All right, so the main questions, and I hope I'm still in time, and the main questions that I get when talking to people is, so, you know, how does it work? Like, how do we work together? What do we need from us? They're oftentimes worried that, you know, they get something for free, and what do we have to give back? This is how it works. You choose your free guide online. So you go to washunited.org, you tell us roughly about your plans, and then you can download the guide. You'll get an email with a link. Then you start your rollout. That's very important. You start it with your own resources, because we're not a funding body. We really specialize in providing the material, but we're unfortunately not a funding body to all of these 700 organizations. And after that, when you're done with your program, I hope you'll continue, but we will ask you, like, on an annual basis, how many girls you reached and whether you have ideas on how we can improve the material. All right, and the second question I get a lot is, what exactly is and can be contextualized, and what support is it that I can get from Wash United? And when it comes to, you know, developing new material, of course, there's three things that we always, you know, take a look at. It's on the one hand, which languages do you need in your specific setting, and their translations is usually done on site. And then, of course, they will review the guide and take a look at, you know, what content adaptations are necessary. That can be very different, but a lot of the times it's starting with, you know, the names of the characters to really be able for the girls to connect with the characters, and of course to fit the setting, names and locations. But also, you know, there's the story. The girl is really in love with a singer in the story, so that of course is easy to change. But also the products that are being used locally, as well as the terminologies. And then myths, of course, is also a big topic, and that is being addressed and changed when needed. And then in terms of the design, you'll see we have like 4 major designs for the different world regions, but also there sometimes we go in and change, because it just for that specific context just doesn't work. That's actually the only the only part of the contextualizations that involves costs on our end, because we are not doing that. We have an agency who supports us with that, so that's the only part where, you know, external budget would need to be involved. And then in terms of the support from Wash United, like what we always do and what most partners really love is that they can place the cover of, like on the cover of Rosie's World, Ruby's World, depending on which region you're in, and they can place their own logo on the cover of the guide to really feel the ownership over the program, over the product. So we are now very keen on having our logo on that. That's really not important. Also on the side, no one cares about Wash United. So yeah, that's something that we like to offer and that also partners like to have. And then capacity building and orientation webinars, oftentimes partners want that. We do that, especially for kick-offs of large programs. And then we can tell, like, you know, what we contextualized, what changed, and just why MHM maybe matters. And for organizations and networks operating globally, we often also, and there, for instance, Water and People comes into place, offer webinars to make the country offices, for instance, or the network members aware that this exists, that we have the solution available, and that if they already have something, there's no need to replace that, of course. But if they don't have anything and want to get started on the topic, they're more than welcome. Yeah, so I guess it's time to hand over. Are you ready?
Do you want to take a question or two?
We were originally doing it like after the whole,
Okay.
but I can also, like, do we have time?
Yeah, I think we have time for
Yeah,
one or
then we
two.
can also do it now. Does anyone? Yeah.
I was just looking on the website for that monitoring, evaluation, and learning guide. Where do I find that?
Yeah. Well, it comes with the package. So if
Okay.
you order the guide,
Okay.
you will automatically get this whole support set.
Awesome.
But I can send it to you directly.
That'd be great.
And in the future, we're also thinking about changing that so that, I mean, it is connected to the guide.
Yeah.
So, right? So I don't know if it helps you a lot if you have that without.
Okay.
But for you, it would be helpful because you could screen it and maybe get feedback.
we can collaborate.
Yeah, we should talk about that. Yeah.
I had that same thought, wanting to see what indicators are in that guide, and then thinking about our previous sessions and talking through
Mm-hmm.
the indicators. If
Yeah.
there's a way that any of the priority indicators could be built into that
Yeah.
guide for use.
Yeah. Let's
Happy
have
to,
a conversation about that. Yeah.
Right.
Cool. Yeah.
What's your threshold for large scale?
What do you mean by threshold?
What your base, like the
What for us is large scale? Everything above like 50,000 girls. But to be honest, we're not like super strict with that because oftentimes when there's, for instance, a pilot plan that is a governmental body is planning. I mean, we would not stay away from that, right? We would still support as much as we can. But yeah, so that's just in my head or also like on paper when we kind of categorize our projects. Above 50,000 would be like a large scale, but that doesn't mean that like smaller projects won't get any support. It's just we have 700 organizations using the guide, so we cannot offer the same support to all of these, unfortunately, 700 organizations. So we're trying to focus on, you know, really very promising programs that are maybe supported by governments. We've talked about that a lot in the past 2 days. Yeah, because that's what we really want to support. We want to support all of them, but yeah, we have not all the resources we'd like to have. Any other questions? No? Okay, we'll have more time for questions later. Thank you.
Great. So now I get to offer a tangible example or a few quick examples of how Water for People has been collaborating with Wash United to really use these materials and in somewhat different ways in different places. Oops. what is happening? There we go. All right, so starting with Malawi, we did start with a broader session that Wash United offered to several of our country program teams to build awareness of Wash United, the materials they have to offer, what's possible in terms of different names for Rosie, different languages, different kinds of options for how to work together to really expand MHH work and period education. And so that's how we got started, and then several of our country program teams said this is fantastic, we'd like to utilize this, and started really using the materials. So in Malawi, they used the off-the-shelf version, which was already contextualized to where we were using it in Malawi. And one of the things I really like that Lena noted that I want to emphasize is this training of trainers model. So I feel like it's really empowering that you can train a bunch of people who then go train a bunch more people, and so it's very scalable. And the first couple examples I have are a little bit smaller, but then in the end we have a very exciting example of scaling on quite a large, in quite a large way. So in Malawi and Chikwawa and Nino districts, it was Rosie's World, and you can see, I won't read all of the numbers, but we trained quite a variety of people. So mothers groups, teachers, the school management committee, education officials, and then of course boys and girls. And so getting lots of different groups involved in this. And then the other thing I'll point out is that I just want to emphasize, I don't know if you can see very well, but there's these little blanks throughout the materials so that it's really easy to fill in, you know, this is our local movie star. And so if the blank asks for a movie star or a popular musician, you can fill in something that's going to be relevant to the age group, to the gender, to the location. And I just think that's really cool that the materials are already set up so that the experts in that specific area can make them applicable really easily. So then in Rwanda, we also used Rosie's World and had another training of trainers with 80 teachers in a couple of districts. And then we have a plan for working with those teachers then to do the training of the students. And we also really like our monitoring at Water for People. So I love that there is the whole monitoring and evaluation guide that goes with it. We have a plan to work on that in 2026. And yeah, the story guide made it really applicable, and our Rwanda team was quite happy with how that went. So very exciting. And then getting up to some of our scaling up, also noting that, so then moving to Latin America, it's El Mundo de Rocio. And so being able to change it for a name and of course the language that's appropriate to the area. Again, we used the off-the-shelf product and did more training, but here what I think is interesting is the amount of different kinds of groups that we did this training with. And you can see this whole list: environmental sanitation workers, physicians, laboratory technicians, quite a variety of people who found this helpful and who we were able to offer this to. And then again, the way that the people that we trained are now scaling it to help educate more people. And then in the most exciting thing, I didn't actually realize that we were reaching this many people, so I was super excited about this. Rolling out El Mundo de Rocio with the La Paz Department of Education, and in this case, the guide was slightly contextualized to add the Water for People logo to it as we were supporting all of this. And then we have a plan in 2026 reaching 2,800 teachers who have the intention to then train 1 million students, or 1 million girls, which I just think is a really exciting example of that large scale that Lena was mentioning. And we're excited about this partnership with Wash United and the kind of support that we receive from them as needed, and just the availability of these really excellent materials. And so I think we're excited to continue the partnership and the education. So that was just a quick example of what's possible to do in partnership with Wash United. So, and now I will turn it over to Emily. So I've given an example of using these materials, and Emily from Splash is going to talk more about how to work with boys education.
Boys and caregivers.
Yes.
Yes. All right. And we'll be taking more questions once I wrap up my section and before we head into Rose's. But we also want to do this fun little comic. Lena added this in, and you see on top here a man watching a gory war movie, and then he sees, a period product with menstrual blood on it, and he's deeply offended and can't even look at it. So that really just highlights the uphill battle that we've been facing with men and boys and caregivers and sensitizing them to discussing periods a little bit more comfortably. So my name is Emily Cruz. I'm from Splash. I'm the Director of Behavior Change, but in the past 6 years led the design of our menstrual health programming. A lot of consultation with Wash United because they have definitely built an incredible model, and I'm excited to share how their genius and brilliance around menstrual health education has really shaped Splash's approach to MHM. But first I want to talk a little bit about our overall program. So Splash's vision for menstrual health is to transform both the physical and social environment so that girls can be empowered to manage their menstruation with dignity. So we do girl-friendly sanitation at schools in addition to MHM education. This shows kind of like a web of the full, we call it the social ecosystem, so our comprehensive package, which Rosie's World or Ruby's World is a core piece of. When we first started our menstrual health work, we reached out to Wash United, we became a partner, and we decided to do a deep dive, formative research, talk to a lot of sector leaders, a lot of people in this room to figure out, other than the MHM education, what is missing in the space of destigmatizing periods? And what we found is that boys need to know about periods early and frequently so that they can grow into men and fathers and husbands who don't have, horror when they see a period product with menstrual blood on it, like that comic that we just saw. So we have a boys puberty workshop that we do in schools. We do a peer mentoring program that builds off of Rosie's World. So Rosie's World covers a lot of the management of periods, information about anatomy, physiology, what a period is, the number of days, things like that. The peer mentoring program is really to build a sense of community, and so that non-menstruators or premenstrual girls are able to connect with older girls who have started their period, so they can say, oh my gosh, today I'm at school, I started my period, I don't have a product, but I can go to my mentor and get a product or get advice on what bathroom is the best for managing my period during this school window or whatever. So the peer mentoring program just builds that sense of community. And then we also, as I mentioned, we do comprehensive infrastructure, so girl-friendly sanitation, doors that lock, well-lit, ventilated, access to disposal solutions, access to water in the stalls, all the things that you need to manage your period in the bathroom, not in a separate MHM space. And then we also have some digital tools. So we have an app called Olia that's a teacher-facing app where they can go to take refresher trainings digitally, but they also have a couple modules that talk about building confidence to talk about sensitive subject with young girls, or what if a young girl asks me about gender-based violence or reports something, what do I do? Because in these gender club situations or MHM education sessions, a lot of sensitive subjects come up and teachers need to feel equipped to handle that. So Oli is a place for teachers to connect with other teachers that are implementing the program, and to connect with Splash or Wash United or whoever's on the back end, it's usually me, that's getting emails about how to better improve their delivery of the program. And then the last is our caregiver program. We call it the parent program, but it really is any caregiver or a responsible adult in a household for a young girl. We very frequently see mothers join these sessions. Occasionally there's fathers, but we've designed around that to make sure that everyone that's a responsible adult in a household has information about menstruation to support the young menstruators in their household. And I won't go into all the words here, but just to say, these programs have been designed with an eye for detail, again, informed by a lot of the sector leaders that are in this room. So much research and thought around the behavioral constructs that we're trying to shift. How do we target the reactive brain, the knowledge level of the executive? So different constructs have been considered with different program objectives, with all the audiences. and intervention strategies. So if you want to dive into the nerdy side of the Splash MH program, I'm happy to share this slide with you. It's a download for sure. And then this is just a quick snapshot of our boys program. So a lot of the content builds off of the content that you'll find in the Wash United education materials. But we discuss myths and taboos. And for boys in particular, we had to go a step beyond just education about menstruation, because it turns out boys don't want to just learn about female peers. They want to learn about themselves, because boys are also going through a hard transition. Adolescence is not easy for anyone. I don't know if you guys remember being a teenager, but I sure do. And young boys are dealing with acne, body odor, hair growth, toxic masculinity is a big one, wet dreams, a lot of things that they're like, what is happening to my body? I need information about this. So we make sure that the Boys Puberty Workshop covers both the girl side of menstruation and period education, but also the boys' lived experience of puberty. It's with the hope that if they don't feel stigma, they're less likely to tease. You know, if you feel more confident in your body, you're not gonna like look to point the finger at, oh, let's make fun of that person over there because I don't feel good in my body. So that's kind of the thinking behind the Boys Puberty Workshop. And then this is the caregiver engagement session. So it's a once a year at the day that the teachers come to school to pay the school fees is often when we are able to catch the largest number of caregivers, and they're able to sign up to attend a caregiver session. So this is to really build that self-efficacy to initiate the conversation around puberty and menstruation with their daughters. We found a lot of caregivers feel very nervous about talking about this topic because they're not sure if they have the right information, they're not sure if it's appropriate for them to be talking to their young children about it, and often we see that the only point of contact and communication between a caregiver and a child is the first day she starts her period, and it's like, here's your products, this is what you do, now don't talk to me about this again. And we want it to be an ongoing conversation. So this session really emphasizes the importance of ongoing support and correcting a couple pieces of misinformation, because a lot of parents haven't been educated on menstruation. We've seen a huge generational shift in the type of information that girls today versus girls 20 years ago have been getting. So this session is a lot of fun, and as I mentioned, is primarily mothers who attend. So the session guide has like this tear off at the bottom that takes all of the very essential pieces of information in a digestible way that she can take home to maybe her husband or another caregiver and kind of give them a brief summary of the content. That way everyone in the household is in the loop. So that's essentially the Splash MH program in a very quick format. I'm happy to answer any questions or share materials. As Wash United is, we are open source with all of our curricula, so happy to share them. But yeah, happy to take any questions for Laura, Lena, or myself. You can talk if you want.
I have a question about like the relationship you have with the partners using the guides and the commitment to like report back like some basic monitoring kind of information.
Mm-hmm.
How does that process go? Like, do you reach out to them and have like a set of metrics?
Yeah.
Are they is that, yeah.
I'm
How has
happy
that
to
gone?
elaborate.
What is the range of experiences with that?
All right, so it's definitely, as you can imagine, one of the biggest challenges we're facing, because obviously the point when the organizations get something from us, which is the free material, is the point when we get the most information, right? So we do know a lot about the plans that the organizations have at the point when they order the guide, and we are very aware that to 95% is going to change, is going to diverge. So once these organizations register on our platform, which is hopefully easy, but we're working on making it much easier in the future. Once they register, they are part of an automized user journey. So they will receive a check-in when, from us, an email, when they said they would start the program, just asking, how is it going? Are you actually implementing? Is the program delayed or is it canceled? So there's like 3 easy buttons in the email that they can respond to. And the same applies to then when the project is supposedly done because we do know the dates, or the system does. And then they will receive again an email with the request to send us a very short report form, to fill in a very short report form. So it's all via email, it's all entirely automized, and we have managed to increase the report rates a lot over the last 2 years because we made them a lot easier, shorter, and maybe more accessible, like in also, you know, very simple language. But we're still facing issues, like it's still not enough. The gap between the planned numbers and the reported numbers is still big, and we're trying to, I mean, we're never going to close it entirely, but we're trying to make it smaller, that gap. And we're trying to work with incentives. You know, for the early bird reporters, you will receive your logo on the cover, no matter how small your project is. Or we will feature your work on social media if you give us feedback on your on the guide. And so that works to some extent, but we're still having, you know, it's still a challenge. But it's also clear to us that, you know, this is not the only thing that these organizations are working on, right? They're dealing with other issues. It's not their top priority, but we're still very much hoping that we're going to improve that, and that because that obviously supports us in our communication, in our fundraising. So we very much, having this indirect implementation model, rely on the communication with our partners, and we're trying to also, you know, have moments with the organizations to exchange, to have like learning formats for them to exchange, be it like regionally or on certain topics, be it like M&E or other topics. So yeah, we're on it. Did that answer your question? Okay.
We'll go in the front here and then in the back.
Yeah, thank you very much. You mentioned in one of your slides the training you gave to the school management team, the mothers in specific. I wanted to know, what about the fathers? Because some girls are very close to their fathers and they share a lot of information with their fathers. Was it difficult to engage the fathers?
Yes. So engaging the fathers is a little bit tricky. We advertise the caregiver session or the parent session for any caregiver of a child at that school, and we just often see that mothers are the ones that attend. But for the fathers, Splash is designing a new intervention because we're like, we gotta reach this audience. They're so important. They're often making a lot of financial decisions for the household, things like that. We need to reach that audience. So we are currently designing a mass media campaign to build off of our work in Addis Ababa. So it's kind of like our first testing ground of using SBCC. So it'll be a different approach, a media approach to really target fathers specifically. The messaging, the tone, who's speaking in the commercials or the billboards or the print materials, it's going to be to fathers and to community leaders and policymakers. So yes, that's the next step. And we'll go to the back.
Thank you so much. My question goes to one of the people. I think the examples that we have seen today, it is only in Malawi where boys were trained, if I'm correct. So my question was, why is it that it was only in Malawi where boys were trained, and in other context, I think it was only showing girls? Was it deliberate, or was it because it wasn't socially acceptable? And also, if you try to compare where the boys have been trained and where boys have not been trained, are you seeing any differences? What are some of the things we can learn from that to say if we include the boys in this setting, it works better or it doesn't work?
I can answer. So to start with, I think it's important to, you know, do the training with both. No question, right? And that's why we are actually teaming up with Splash, because Wash United has developed this material specifically for girls, and we really want to create a safe space for girls, and also go more, or for people who menstruate, and also go more into, you know, depth, because a lot of the things that the girls learn in Rosie's world, Ruby's world, you'll see is not as relevant for people who don't menstruate. Just goes very into depth, right? So, and on the contrary, the workshop for boys are supposed to, you know, support them to become good allies, to really empathize with the struggles the girls have around their period. So it's a little bit different in terms of the learning objectives. So I think we should definitely, separate that, although I know it's a very binary system, right? We don't have a perfect solution to that yet. However, Wash United currently is only providing this material for girls. Splash is providing the materials for boys. We're actually, it's a good question, planning on teaming up on that. So we're planning on creating a joint platform where organizations can go to and get the material for all audiences. So that's very exciting. We're working on that currently. And yeah, then we're hoping to make everyone happy. In this specific case that you saw here, they did use the Rosie's World. So they did use the material for the girls, but it's not perfect. It's just very elaborate, and it doesn't pay into the objectives that we would like to pay into for the boys module. Do you have anything to add?
No, just a lot to come on our shared platform in the next probably 6 to 9 months. So watch LinkedIn. We'll probably have a ton of posts, and probably at MH Day this year.
Yeah.
This coming MH Day, you'll be able to learn more about how to access white label materials for any audience related to MH.
Very excited.
Elise?
Yeah. So I wonder too, like building on the event we had yesterday around decentralized and local access models, like for those of us in the room that are less often in schools but are working with other actors either in the supply chain or within the larger MH ecosystem, are there particular messages within your curriculum that you hope are being repeated by other actors, especially on the private sector side?
Definitely, but I think that to continue to advertise our shared platform, an exciting thing is that we'll be asking knowledge partners to share, say you guys have local access tools that you want to have solicited on the platform for other organizations to access that have the messaging that's appropriate for that audience. We're open to including other partners to have their materials on the platform. It's not just going to be Wash United and Splashes, because we're designing curriculums for girls, boys, parents, peers, and then of course we have our SBCC work, the pad making, but there's so many other tools that are needed in this space, and the market level side of things is definitely not something Wash United and Splash have expertise in, so we're going to be inviting other thought partners to be contributing in new ways. Tripti?
Yeah. So I want to know, you have been doing this work since many years, and then did you find any difference between the project you are doing with boys in urban areas and rural areas? Because in urban area, the boys have more information. They have different kind of relationship at home, with parents, or they are quite open up, and then they are comfortable to talk about it. But in rural areas, it's quite conservative, right? And people do not have that much information. So have you done any kind of a study, or did you find any difference between the rural and urban?
So because Splash works solely in urban and peri-urban spaces, we don't have that data, but what we do have, we did a large longitudinal assessment of the whole Splash ecosystem, and I'll be presenting on that in the next hour. What we did do was collect socioeconomic background data on the respondents, and a lot of them are recently migrated to urban areas, so they have more of those rural kind of foundational cultural elements that do require a different lens for menstrual health education, and so we're able to disaggregate along that line of the socioeconomic background and where their previous homes were and things like that. It's not perfect, and the data set's really, really small, and it's self-reported, so there's a lot of things to consider with that. But when we do launch this platform and other organizations are using the boys materials or the caregiver materials, if they're implementing in rural places, it would be great to kind of team up and have that direct comparison of the urban populations versus the rural. So lots of opportunities. Oh, we're gonna move on to Rose. She's gonna share a case study from Tanzania.
Okay, thank you. Hi everyone.
Good evening. I'm Rosie Riwa from Tanzania. I hope you can see me, right? Yeah, so we have been hearing a lot about a female speaker, but I think now we are shifting to a male speaker. Oh, I want to change to the video. I'm going to share the video from National Institute of Medical Research to indicate the role of research in education, but in MHH journey for Tanzania. And this will also show the transition from the common voice. You know, we used to talk as implementing partners that there is a problem. But when you do the research, when you show the research, automatically you prove your point when you're advocating and influencing. So this one will go beyond the education. After you educate, then you what? You have to educate, then you go to the other milestone, like access to clean and safe water, access to the MHH inclusive facilities, proper disposal of sanitary waste. So Robert is going to share the role of research in the small MHH landscape for Tanzania. Then I'm going to share about the roadmap for MHH Tanzania. So after that we have the group discussion, then you can discuss more in your groups. So you can put it on. Doesn't.
What's happening there?
Hello everyone, my name is Robert Musanje from the National Institute for Medical Research in Tanzania under the Ministry of Health. I'm excited to introduce to you the story of menstrual health and hygiene progress in our country, which I hope you're going to enjoy. And I will be talking about the landscape where we are and the role of research in shaping the policy of the country. The government of Tanzania is committed and has taken major steps to address the challenge of menstrual health and hygiene for women and girls, recognizing that it is important for their health, dignity, and for socio-economic development. Tanzania now has a comprehensive national guideline on menstrual health and hygiene, which was produced and approved in May of this year. The guideline covers 5 pillars of MHH, which includes inclusive knowledge, improved materials and products, supportive facilities, positive social atmosphere, and stakeholders engagement. It also covers all relevant age group of menstruators and provide for key sectors, that is health, water, community development, government administration, trade and finance. Thanks to the government commitment to menstrual health and hygiene services, these services are now integrated into our service delivery in primary and secondary education through school wash guidelines and through the national curriculum, which now covers topics for learners and teachers alike. It also is integrated into the healthcare delivery system through the WASH in healthcare facilities. Tanzania also has one of the most vibrant national coalitions for menstrual health and hygiene, which brings together NGOs, private sector, development partners, and the government itself. The coalition, it was formed in 2015 after stakeholders led first ever commemoration of the Menstrual Hygiene Day in the country. The coalition now has more than 200 members. In terms of programming, menstrual health and hygiene has been mainstreamed into the water sector development program, which is a sector-wide program for the country. This is indeed a very important policy milestone. Through this program, the country has achieved very tangible results, including construction of female-friendly toilets in 1,647 healthcare facilities and improvement of infrastructure for 1,952 primary and secondary schools across the nation. These achievements marks the very, very tangible improvement in accessibility, privacy, and dignity of girls and women in those areas. Research. Stakeholders' voices brought the matter into attention. However, in our case, scientific evidence was very, very pivotal in moving the needle towards tangible policy change. So in 2019, NIMRI led the representative survey that systematically assessed and documented MHH challenges among girls in school. And the findings revealed that only 28% of girls had adequate knowledge on the subject, and only 21% of teachers had received training on menstrual health and hygiene for school. Just 17% of the schools had clean and safe spaces for personal hygiene, that is the special rooms for girls. And because of that, we also found out that 17% of girls actually reported missing school during menstruation, just for within the 3 months preceding the survey. So part of these results are already published in peer-reviewed journals, and the entire report of this is available online. These findings then became very essential for policy transformation. And after that, we saw the changes, including the programming of menstrual health and hygiene into water sector development program and drafting of the national guideline, which I've spoken about. Right now, we are focusing on disseminating of the guidance from the guideline that has been passed. And despite the progress, key challenges still remain, which we are going after. So the task of breaking negative social norms, the challenge of improving access to quality menstrual products and materials, the task of developing and maintaining MHS standards for schools, market, workplaces, and health facilities. We now focus on disseminating and implementing the guidance. And despite the progress, we still have tasks ahead of us. Firstly, to break the negative social norms across communities in the country, improving access to quality menstrual materials, developing and maintaining menstrual health and hygiene standards that we are only starting to usher for schools, market workplaces, and healthcare facilities. We are grateful for the achievement that we have gained over the last decade. And let me recognize my colleagues from Ministry of Health, Ministry of Water, Ministry of Community Development, President Office, and the entire government of Tanzania. Our development partners and stakeholders, especially Water for People Tanzania, UNICEF, UNFPA, and Menstrual Health and Hygiene Coalition partners for their contribution to this work. We are very much looking forward to also learning from your rich experiences wherever you come from, and thank you very much for your attention. Thank you.
Thank you so much. I think we have heard from the government representative. He was supposed to be here in person, but he couldn't make it. But now, having from this presentation, I'm going to provide a simple highlight of what we have done as MHH Coalition, but as Water for People, as member of coalition at the national level and at the national level. And my presentation will also indicating the roadmap. I'm trying to change this. I hope you can now see it, yes. Yeah, so I'm going to showcase the roadmap, but as we know that Tanzania is one among the countries that have menstruating girls. And we have added that more than 1 billion women menstruating globally. So for us, according to our national census, we have almost like 15 million women menstruating. And actually, that is one among the biggest population, because our national census for now we are in 61 million. So among 61 million, 15 million are menstruating. And you can see the journey of MHH, starting from what you have heard regarding education, but now the journey of MHH for Tanzania, how do you start before you educate? So it started by non-state actors. It was a lot of non-state actors. I remember it was 2015 where non-state actors have done the simple survey in 80 districts. It was SNV and other non-state actors. And that was eye-opener for the government, because from that assessment, it indicates that there is issues in MHH. Girls are missing schools in MHH. Students, they are using unsafe material in MHH. Students are lacking the proper education in MHH. So from that survey results, we as non-state partners, we use those results to advocate. And that is 2015, whereby we have the coalition, we formed the coalition. And our coalition included the people from the government, people from the NGOs, people from the private sectors, the suppliers, the producers. We all speak one language to advocate, because you have seen the problem there through the assessment. And from this one, we also, in 2015, as a government now, or as a nation, including non-state attended government, we see that there is capacity gap within the country. So through the support of UNFPA and the support from the government of Tanzania, the country has been able to train the MHH train of trainers. And I thank God that I happen to be the one among the national TOT at that batch. And that was like we are creating the pool of MHH technical people in the country level. And after that, we noted that we need to have more media people. We as a worship practitioner, we are very few. We cannot reach most of the people in the country. So how can we trigger that? We train journalists, and after we train them, we establish the award for journalists. So the one who write most in MHH, at the end of the year, during the Global MHH Day, they are going to get an award. And in 2019, that is when we start, as a country, we have the formal assessment that was done by NIMRI. NIMRI is a government institution, but the first assessment was done by non-state actors. You know, sometimes when you have something, when you have research done by the government, the buy-in sometimes is very little. So the research was done by NIMRI. We support it from UNICEF, and UNICEF is also a member of the MHH coalition, and that research informing the sector. And from that time, we started to talk about the policy change. As we know that the theme of this conference is from science, policy, then practice, right? So the science we get from here, it informed our policy, it informed our policy discussion, and that is when we include MHH for the first time in the Water Sector Development Program that is started from 2021 up to 2026. It was not there before, but from the evidence generated from those studies, it helps us as non-state actors, people who can influence, people who can also kind of advocating to include that in the, to advocate for government to include MHH in the Water Sector Development Program. And we thank God that this year, 2025, through the support of UNICEF and MHH Coalition and of course Water for People, we have been able to support our government to launch our very, very first MHH guideline that Robert was speaking about. So that is our simple MHH journey, and I'm going to highlight some of the issues that we did together. Starting from what we know, this is a three-pronged approach. I know some of us, you are aware. For you to do MHH in a holistic approach, you need to have education part to breaking the silence, increasing awareness. That is why we are partnering with Wash United. We are partnering with Splash and other global initiative and regional initiative to make sure that we align and to make sure that we educating women, proper education to the women and adolescent girls and also men in our communities. But that is not enough. What we do also is we see MHH is beyond education. So we do some work at the local level, at the national level, to make sure that there is a proper use of and access to proper menstrual materials and also wash infrastructure. But of course, when you train, when you educate, people awareness is raised, then they will use sanitary pad more, right? And then after that, where are they going to dispose? That is also required to also touch a part of disposal, because the education can be there and the people can now start to use proper materials, to use to manage their menstruation in the hygienic way. And then if you don't touch the disposal site, then you can, I think some of you come from the city where you can observe sanitary pad there in the street. Yeah, so that is the issue, that you need to combine both. You need to combine education, access to clean and safe water, wash services, and sanitary pads, and then proper disposal of menstrual materials. So we as Water for People, we sit at the national level for Tanzania. Our strategy requires us to provide dignified services, wash services, reliable wash services to all groups, including women and girls. We have slogan of leaving no one behind, and for that regard, we are also doing some MHH work at the local level through our Everyone Forever model, and you're also doing MHH at the national level with collaboration with other partners, of course. And in our advocacy, we normally we don't do alone. You know, they say, what they say, alone you can go faster, right? But together you can go further. So we know that. That's why we also align ourselves to partner with other alliance, networks, and coalition, so that we can generate evidence that we are getting from our field office. And from the evidence, we use the evidence to advocate in collaboration with other partners at the national level. So we, together with TAWASA and Tanzania Water and Sanitation Networks, we have supported them to do the wash budget analysis, and through that we know how much is allocated rural against urban, how much wash budget is allocated, and how much wash has been used at different levels, including in school wash. So that also, those information help us to develop the advocacy message at the national level, and those advocacy messages cover different areas, including the MHH groups, and the message for adolescent girls, at least to advocate their right to get best wash services in school and in public places. But also we are a member of Women in Wash Alliance, where we advocate for women's right to get access to dignified latrines that have all essential materials and essential needs for women. But we are also part of the MHH coalition, and through that, Robert have started to say about it, but through the coalition, I'm going to highlight some of the things that we have done together with coalition. The picture you are seeing there, you see the picture of it was the member of parliamentary meeting. So after we did this kind of assessment, this kind of research together as implementing partner, normally we are developing the key advocacy messages, and we use those key advocacy messages to different policy forums, including member of parliamentary meeting committees. So the picture you are seeing there, we was advocating for MHH, tax reduction in sanitary products. Because we said women cannot pay tax for their blood. We don't opt to menstruate, right? It's a biological process. Why should we pay tax for it? So we are advocating to different forums. Yeah, sure. I don't choose to have period. It's like you men, you don't choose to have the heavy voice. It appears when you grow up. So imagine you are paying taxes for your heavy voice. That is not fair. So through advocacy, we've been reaching different groups. We reach member of parliaments. We go to the key decision makers. We advocate as coalition now, because I have said Water for People is a member of coalition. But also, they say nothing about us without us. Through those advocacy focus session, we normally go with the students. They speak, you know. Sometimes people, they can see that you are exaggerating things, but when they hear direct from the student, then you can say, okay, these things are there. So we normally carry the student, women with disabilities, to those advocacy forum. They speak themselves, they raise their voice regarding the different issues that they are getting. If I cannot see, then I'm in my period, what is the experience that I'm getting, what do I need to do, to have for me to have the safe menstruation. So all those things that we use to advocate, and we create those messages together as coalition. And actually, in the part of education, and we do the collective action from the evidence generation to adopt MHH education from the global level. Actually, in our guideline, we have 5 toolkits. One among the toolkit is Toolkit for Education. So we believe as a country, we also need to use the global material, but also to develop our tailor-made material that also rely on our context. So the government has used different sources during the guideline development. They have developed the tailor-made material for Tanzania. So we have the Toolkit for Education, we have the Toolkit for Sexual and Reproductive Health, we have the toolkit for monitoring and evaluation. So the guidelines have several toolkits. We have the toolkit for facilities, we have the toolkit for material supply. So all those things were being informed by the evidence generated from research, but different reference from WHO, UNICEF, WASH United, Splash, and other global organizations. So all these things have been used to inform us at the country level to develop the kind of materials, but also to develop some kind of advocacy messages based on the scientific evidence generated at the different level. And the other actions that we did, we active engage in high-level police forums. We are advocating MHH to be included in the National Health Policy. We are advocating MHH in the technical working groups. And actually, MHH indicator is now included in the water sector development programs. We advocate it to be included into different forums, like in SWASH guideline. Now Tanzania, you cannot build a toilet without providing the specification for women's or adolescent girls in public school, but also into different police forums, as I have said, in Member of Parliament. And actually, sometimes we won, because there is a time that the government took over the tax for the sanitary pads after we make a lot of noises. It is not easy, but they did it. But just like last year, the government also took away the tax for local manufacturers of sanitary pads, because they wanted to encourage people at the national level to develop the sanitary pads. Those companies that originate from the local level to develop the sanitary pad, because they thought by doing that it can create affordability. And now we are advocating for girls to get free pads in school. I know our government have done a very great job of including sanitary pads, to provide the sanitary pad, emergency sanitary pad for students through the capitation fund. But we thought that is not enough, because sometimes different schools receive different capitation fund, and it has a lot. They're supposed to buy charts, they're supposed to use that fund for other administrative work, but we are now advocating for free pads in primary school or public school. So that is what we are doing as a coalition at the national level. But also, you see, at the picture you are seeing, we have tried now to include the influential people, leaders, as a MHH champion. We have male member of parliaments who are MHH champions. We have female leaders who are MHH champions. We have the wives of leaders who are MHH champions. The one you are seeing there is the wife of our Vice President, Honorable our Vice President for Tanzania. She's called Mbonimpai Mpango. So she's also the MHH champion. Why do we do this? We believe that these people have influence. They can speak, people can hear. and they can also influence decision making. But also we are trying to engage as much as possible key influential faith leaders, political leaders, but by our level best to make sure that everything is incorporated and then we're advocating for the changes together. So apart from that, we have been using arts and ground activation, as Emily said, you know, to reach, you may reach a student in school, but there are other women who are not in school programs, like adults, or maybe out of school girls. So for you to succeed, sometimes you need to use other approaches, like SBCC, use of arts, use of, we are doing at least a marathon in every year. I think during the MHH Global Commemoration Days. Before that, we are doing marathon, ground activations. We are doing kind of media's broadcasting, media's involvement, because all that we do, we needed to reach more women with MHH education and MHH light information. And okay, other action that we are doing, as I've said, media platforms. We train journalists, but also we also provide award for those journalists who wrote MHH throughout the year, because we thought they are reaching a lot of people through their social medias, through their medias. So we hope by doing that it motivated them to write more on MHH and breaking silent, and people can hear more, not only from us as technical people, but also from media, by understanding the role of media to bring transformative MHH trends for Tanzania. The picture you're seeing is the Deputy Minister for Health providing the award for the best MHH media, and the one you see is a male. So we also we activate men to talk more, to educate female on MHH. So he won the award. Yes. So men can do it. Actually, men can do it. And even in our MHH coalition, our secretary is a male, Severin Rute. So we are trying now to bring a lot of male in the picture, because it is not something that they can feel shy. It's something that we need. It needs collective effort. It needs like collective effort to make sure that we are safe. Because you marry a woman who does not, if the woman does not have the proper menstrual health, it can cause several issues, including sometimes barrenness. So it's the responsibility of all to educating women and to make sure that women are free and they are healthy and they are getting their right to proper menstrual hygiene education and also menstrual hygiene services. So of course, the key lesson learned from our session is success needs the coordinated efforts, and also national guideline reflect on a multi-sectoral approach, because it is not one sector thing. It needs coordinated efforts, and also changing norms through education. Community engagement reduces stigma. So we have done several ground activation. We have used the community health workers. We have used the teachers, students. But if you engage community properly, that is when you also reduce the stigma. But capacity building improves support at all levels. So you need to build capacity at the all level, national level, local level, non-state actors, state actors. We all need to include our effort to make sure that we are supporting women and girls to have proper menstrual services. But also, facility must be inclusive and maintained. There is issue of sustainability in the facilities, but also data systems that are vital for tracking and planning. So all the things that we have learned in our MHH journey, but of course, we have big surprise. In our advocacy, we noted that males were more supportive. Sometimes, in some scenario, males were more supportive. When you introduce the session, maybe in the Member of Parliament, you find that males are more positive, more supportive sometimes. So that is our biggest surprise. You could have thinking otherwise, but sometimes females think that this is something not to speak. Why are you speaking about this? This is like, it needs a privacy. Why are you speaking? But sometimes men, they are supportive. So that is our surprise here in our MHH journey. So maybe you can clap for males. Yeah. And several challenges, including poor monitoring, especially in rural urban disparities, lack of inclusive design, apart from the good work that government have been doing, but still we have some facilities that lack the inclusive design for women and girls, and high cost and limited availability of menstrual products. We have several, but still some of women still cannot afford sanitary products, and also cultural taboos. Apart from what we have been doing with the influential people, but we're still facing kind of taboos and bad social norms. But also limited investment to address need of people with disabilities. Yeah, we have education materials, we have several resources, but sometimes the material for people with disabilities are still limited, and I call upon the action from different stakeholders also to include, to invest in this area. But there are also knowledge issues, apart from all the great investment that we are doing to ensure that women get the proper education, but we are still facing challenges. Some of the women, they're not yet to get access to these educational programs. So those are a few challenges that I wanted to highlight. By saying that, thank you for your attention and thank you for listening. So up to you, Laura. Thank you.
Thanks, Rose. Changing up the program just a little, so much enthusiasm and so many great questions. So we've run out of time for group discussion, but I do think we have time for one, maybe two questions for Rose about her presentation, or any other questions you have in general. Yes, please.
Yeah, thanks so much for the presentation on Tanzania. I think it was very interesting to listen to the journey. I'm just wondering, you spoke a little bit about the coalition, the different groups that are there, you know, the changes that you advocate for, but have you seen a change in the guidelines, obviously, that came out this year? Have you seen a change in the government budget that is being allocated for mental health, and if that has happened, to what areas is the budget going, and maybe from which sectors is the budget coming? I don't know, maybe it's too complex, but you know, in case you have these answers, would be great.
Okay.
Thank you.
Okay, so maybe I can take that on. Actually, through Tawa Summit and Women in Wash Alliance, we went beyond MHH. We are looking for increase of WASH budget. So when you speak about WASH, actually MHH, it is part of it. And we really thanks our government, because in this financial year that started from July, the WASH budget was increased. I don't remember the figure because I didn't prepare for it, but it is one among the year that the WASH budget was increased, both for water and for sanitation. It used to be different in sanitation. It used to be somehow budget increase for water. But now the government, especially Minister of Health, has put the sanitation and hygiene as one among their top 10 priorities. So now we start to see budget increase in sanitation and hygiene, which also MHH fall in that areas, but also budget increase in WASH. So it's something that we see changes, and it's good to continue to invest through advocating on that. Thank you.
Great, thanks, Rose. Kelly, super fast?
Oh, sorry. Thank you so much for the presentation. It was amazing, honestly. I missed the beginning of the session, but my question would be how, it sounds like you're doing advocacy with the budgets for school WASH, and then of course for WASH in general. Is there like a concerted effort for out of school adolescents, for example?
Okay, thank you. I have said through the school, we are reaching students through the school programs, school curriculums, SWASH clubs, other like normal MHH session in the school. But out of school girls, I think we are all aware sometimes it's very hard to reach them, unless you use community health workers trained on, unless you use the medias. That's why you see we are using medias. We are educating the journalists to provide the proper and right education, but also we are using SBCC. We are training sometimes the influential people at the local level who faith leaders, those people that can speak and people can listen at the community level. So that is how we reach the out of school adolescent girls and of course the women, but it is something which is done out of school through different platforms like the one that I was mentioning. Thank you so much for your good question. Yeah.
Thanks, Rose. Great questions. So thank you all for being such an enthusiastic and engaged audience. Lots of great discussion and questions. Here's how you can get the materials from WASH United. Also, please feel free to come up and talk to any of the speakers afterwards or throughout the rest of the conference. Very excited to see how much of this there is at the conference. I love this point that menstruation is a sign of good health. I think that's a really nice advocacy message. Love this discussion that Rose mentioned about how science is critical to influence policy, and the point that Emily made about the importance of not just the physical environment, but also the social environment. I think those are a couple of nice takeaways, but I did also want to point out we had, I think at the most in this room, 2 gentlemen, so thank you for joining us. But the fact that there were such a limited number of males in the room, I feel like does remind us that we still have a ways to go on this journey. So hopefully this session and the camaraderie are some good inspiration for us to keep going down this road. So thank you all.
Can I make a PSA for those who have not heard me say this before? We have a informal session on mental health and the leadership agenda for action for global advocacy for mental health. So it's gonna be at 4:30 in the room next door. It's not in the official program, that's why I'm just like stepping up my soapbox and taking the space. But we have flyers. 4:30 today, next door in Bellflower. Thank you.
Thank you.
And if you want to have a look at our material, I'm happy if you check them out.
Yeah, and I'll be happy to connect for those who are working in Tanzania. Yeah, thank you.
Very nice. Yeah, that was great, guys. Thank you.
Hi, how are you?
I'm fine.
You're welcome.
How about you guys?
Habari, mambo? Poa.
Really?
Yes, our office is headquartered in Dodoma. Yeah.
Another one.
Now you're going to get it.
Is that 30? It's so confusing. Yesterday we were all confused with the afternoon break.
When are you coming in? From Care International?
From Care. Yeah, sorry.
I would show if it is. 3:15 to 4:30.
I know the presentation.
Oh, great. 3:15. So if you want a snack, you better go get it now.
Are you? I'm deputy director.
I'm just helping with the table tomorrow, but not anything formal. Now I'm gonna go hang out in lots of meetings. That's awesome.
But yeah, I'm always trying to push it down in the water program, like pushing in other programs, care is
We are opening for partnership with Tanzania.
I am very curious. We don't talk about it now.
But we are there guest in Tanzania, so we are opening for partnership.
And then we gotta
Exactly, and the important thing about that, we have
A smaller piece of our program.
and of course, so I know you have your own position there, and you have support for people. When we have a strong to apply for the grant at the global. Yes, I understand that through USA, you support. They don't have